Good afternoon. I am going to be speaking briefly about Sacramento County Behavioral Health Services for people experiencing homelessness. We'll cover what some of the benefits are and how to get folks referred. So we want to improve the overall understanding of services available to folks experiencing homelessness, how you can help people access those services, learn a little bit more about how behavioral services has recently been making an impact with dealing with homelessness in our community. And if need be, we can have some time for discussion or questions. So to kind of give you some context about our programs, we want to provide kind of our level of services mapped to the level of services of housing interventions. Like with the COC, we start with the lightest touch. So most folks who come through us usually go to a low intensity provider. These are folks who can manage with some medications. You know, they need to check in, they need to see the doctor every once in a while, but for the most part, they're stable and are being seen a couple of times a month at most. And these programs offer short-term financial support. So we can do prevention of homelessness, and we can also do brief, rapid rehousing type interventions. So our low to moderate, that's kind of our regional support teams like HRC, El Hogar, Visions, and all the children's fit providers also are considered low to moderate. And again, these are folks who are independent, semi-independent, relatively stable in the community with supports. And they can have rapid rehousing in those programs also, and that can go up to 12 months. Please be aware that we do not have an extensive network of landlords just yet, and some of our folks do not have incomes or are trying to apply for incomes. So frequently room and boards are often used because it's easier to get a client in there than to pass background checks, get security deposits, or able to get into an apartment immediately. Then we have our moderate intensity providers. So that's kind of like what we do with a lot of traditionally as traditional housing or permanent housing, supportive housing, not chronic. So the person is literally homeless and they do need a bit more intensive care than is offered at the other two levels. So maybe they need reminders to take their meds. Maybe they need help with transportation. Maybe they need assistance, tackling a large application. There's some more freedom for some more intensive ongoing supports and some in community, but it's not expected to be long-term. It's just somebody who might be in crisis or need a lot of case management up front. And we do have permanent supportive housing for people who are chronically homeless at our higher levels of care. They're called our high intensity full service partnerships. We have quite a few. We have SOAR, ARISE, ISA, we call it SOUP, it's Sierra Elder Wellness, Pathways, New Directions, and Children's Wraparounds. So they serve people who have more intensive mental health needs. For example, these are folks who might be getting hospitalized, who are having crisis in the evenings, might be having difficulty maintaining their housing stability because of certain behaviors. We do have built units for people who have experienced chronic homelessness, but our providers also have the liberty and the funding to support people longer term in just scatter site housing, apartments, etc. So we try to link to whatever we have, but we do have access to built units and funds for more permanent or long-term housing supports. So what will we do for a person experiencing homelessness that tries to or wants to use our services? We do individual therapy, medication support. We help them get connected to whatever benefits they might qualify, GA, SSI, anything. We do homeless prevention. That could be a behavioral intervention, like maybe they need to address an anger management problem. Maybe they need a budgeting class. Maybe they need somebody to advocate to the landlord to give them a second chance. Or maybe they need half of the rent so they won't get evicted. If the housing instability contributes to their mental illness or their mental illness contributes to their housing instability, we are justified in using our funds. There are some limits. Again, there must be a connection but I think all of us who serve this population can agree that folks experiencing homelessness are experiencing distress, and it's going to impact their mental health. We also can make referrals for other programs. So we can hook them up to a primary care physician. Do they need to be assessed for drug and alcohol services? Do they need maybe help going to a parent support group, or dealing with work requirements from probation, etc.? We'll help them navigate that. We have co-occurring disorder groups and support groups. We do case management. Again, the intensity of case management has to do with what level you're at and what you're experiencing. Psychosocial rehabilitation, that could be something like somebody comes into the office and works out some interpersonal difficulties with a partner, or it might be actually out in the community hand over hand, how to deal with a stressful situation. Community integration, that's our number one goal, is to get people back into the community where they can feel a part of it and feel like they belong. Supportive housing, like I mentioned, we do have built units, and we do have funding to provide rent and rent subsidies to folks and provide the support in whatever housing they're living in. And we help try to remove barriers. So we might try to hook them up with an expungement clinic or credit counseling to get rid of bad credit. So where can folks who are experiencing homelessness go and get services? We actually have quite a few front doors, if my little dog will let me tell you about it. So there's a couple of access points that are in red. These are ones that are probably a little bit more accessible to folks helping people. The ones in black are kind of our own services already. So we get referrals from the mental health urgent care clinic, from the youth detention facility, from Sacramento County Mental Health Treatment Center. But for you and the folks you serve, the best ways I will list out right now, they're the ones in red. It's the mental health access team call. So I know this sounds a little intimidating to some folks. It is a call center. I worked there, so I can tell you a little bit about what happens. Is a person calls up and says, I want services. And as I do an assessment, I'm looking for distress. I'm kind of asking them how they're doing, how they're feeling, how they're sleeping. And I would always ask about where they're living. So we assess all that information. And if they meet our target POP, for example, major depressive disorder, post-traumatic stress disorder, the policies available on our website, we can immediately link them to services, whether they're homeless or not. I would talk to that person and go, what's your preferred neighborhood? What's a neighborhood you would not prefer? And I go ahead and I link them to that to that provider. And if need be, try to kind of give them some help getting their first appointment. I know for some folks, making a phone call could be a little intimidating and anxiety provoking. So a couple of other options are the Guest House Homeless Clinic. They still do orientations. I would suggest calling ahead because of COVID. They have somewhat restricted amount of folks they can serve at once, but they have orientations Tuesday, Wednesday, Thursday, and the orientation is neat. So they kind of bring people in. Hey, this is what our services are about. Do you think you qualify? If you think you qualify, stick around for a minute. And they get the people processed and intaked, and usually can get them intake pretty quickly. Now, you might have heard some rumors about Guest House I wanted to spell. It is true that it can take a while to get an intake appointment, but there's a pretty large no-show rate. So they do take people on what they call an on-call basis. So they have a drop-in center anyway. So if you wanted to just go and hang out and go, hey, did somebody call off or not show up for their appointment? You would be on standby and you could get that appointment. So even though appointments might look like they're a month out, most people actually get their intake when they use the standby process in less than a month. Wellness and recovery centers, same thing. They each have an orientation at the south and the north. Same thing. They always have a standby process for folks who want to get that intake. There's the mobile crisis support team. They're in the community. We do not necessarily have the ability to dispatch them, but when folks call for like a welfare check or somebody's behaving in a way that makes you worry for their safety or the safety of others, if you communicate that to dispatch, they will sometimes send out the mobile crisis support team, which actually has a law enforcement, licensed clinician, and a peer staff. And they will meet the person where they're at, wherever in the community they are, and will try to link them for services. Obviously, it's the person's choice, but they always make that attempt. There's a community support team. Now, this is one of the few where you can make a referral on the person's behalf. So, for example, you're working with somebody who's they're just so anxious right now, or maybe so possibly manic, that handling a phone call, is just too much for them right now, or they're having a hard time navigating. The community support team will triage the referral, and within a week, you'll get a response. And sometimes, depending on what the need that is assessed to be, they will go out and actually do an assessment for services out in the community. It might be at a shelter or an encampment, or these folks will go wherever they are called to. And they're also very willing to work with the support persons or case managers who want to be part of the process. So access team, like I mentioned before, they're great. There's 15 folks on staff at any given time. And we would process literally hundreds of requests every month and successfully link people to services. Phone call, again, it takes 10, 15, 20 minutes. When you call in, if you want to support your person, you want to support your client, as long as the client says it's okay for you to talk or support with them, the access clinician is going to be willing to take whatever information that you think is helpful to the assessment, or to kind of just be a support person while they make that call. And then we also did this more recently, and it's been fantastic. We have an access clinician who actually goes to the shelter sites and kind of puts up shop, and he does like a rotation through all of them and tries to identify folks who might be in the shelters who are interested in services or may qualify for services, but for whatever reason haven't gotten around to making that call. He's actually participating in a pilot project right now where he is going out to an encampment to try and engage people that way. So yeah, he supported 10 shelters, 36 on-site assessments, and plenty of people have qualified to go onto a mental health provider. Again, he respects voice and choice. It's people who want to be assessed and want services. He encountered children, transitional age youth, and adults. And since being at the encampment, I know he's already successfully, just within a week, linked about half a dozen folks to services. That's been very exciting. So the front doors where you can just walk in, like I mentioned, is Guest House, WRC North, and WRC South. And as you can see, they're pretty spaced out throughout the community. So for folks who want to go see what it's about and want that face-to-face interaction, I would suggest that. All three locations have a form of a drop-in center. Guest House has a homeless-specific drop-in center where they provide lockers, showers, laundry, snacks, phone charging station, TV, movies. So if a person wants to get out of the elements and kind of get an idea what services are about, they could just use a drop-in center. A case manager will go and actually do outreach within the drop-in center while somebody's maybe charging their phone. They'll go like, hey, have you ever thought about services? So they capture people that way. And WRC North and South have peer-led support groups all day, every day, literally 9 to 5. So these are people with lived experience with mental health and or homelessness. And they do everything from crochet 101 to coping with bipolar to field trips to the farmer's market on the weekends. So for folks who are reluctant and want to get a better idea of what services look like, these are the 3 best places to send them so they can actually see other folks like themselves getting services and participating. So I will give you a little bit more of a visual, and I will provide the slides to you. I'll email them. So Guest House Homeless Clinic, again, 18 and older, Tuesdays and Wednesdays at 10 and at 1. They offer all the same things that all our providers do that I mentioned above. Another great thing about the Guest House Homeless Clinic, they were pretty much our first provider that really started working with Sacramento Steps Forward and the COC. They were the first in HMIS. So they were our flagship provider for folks experiencing homelessness. So I've always had like a soft place in my heart for them. Connections Lounge. Some of these are actual pictures. Those are really their lockers and their bookshelves. So the drop-in center that I mentioned earlier, 9 to 3, light refreshments. I forgot about the computers. And they do sometimes have like creative activities. You do not need a diagnosis to participate in the Connections Lounge, to just go and hang out and feel welcomed. They refer to everybody who comes in through the door as their guests. And another great thing about them, they actually also have a program within a program where they help you apply for SSI benefits, and they're great. They will automatically appeal if for some reason you don't get it. They have relationships with the Social Security Administration and Disability Determination Services. They will help a person fill out forms. They will act as their PO box for any kind of records. They will get the release assigned by the client and request those records. They do amazing hand-over-hand work with folks in order to get them their benefits. So you do have to meet, obviously, what assumed disability requirements. You do have to be enrolled in one of our programs. And this is unfortunate. This isn't our program rule. At least as documented, the person should be clean and sober for the last 90 days. If there is complications due to substance abuse, it can delay getting approved. Wellness and recovery centers. Here are their sites, and I've got their addresses and phone numbers. Again, I always think it's a good idea to call because with the COVID, they have showers and laundry at both locations. It's first come, first served. They also provide all the same interventions that the rest of our programs do. But again, there is laundry, showers, computer lab, and I bring this up because it's true. Ping pong and foos table are very popular. So there's always folks just kind of like hanging out. They might be playing board games. They might be in one of those support groups, but truly they have extensive group programming, and a person can be receiving mental health services by any of our providers and still utilize their peer services. So you could be with Guest House, but go over there for bingo or for crochet. It is not a problem. It is not an outpatient program, the peer services, so you don't need a diagnosis to get those peer services. So like I said, so that's that one-on-one counseling with somebody who's got the lived experience. Choices I also forgot to mention, there's a lot of art stuff. There's a lot of coping with different symptoms that come along with the diagnosis that can get you eligible. And both sites have community support team, which I mentioned earlier. There's the referral number, and that will be on the slides that I provide. They try to be proactive. They're trying to avoid a crisis from happening. They're trying to intervene where the navigation is so difficult that it's really making a person reluctant to get services. They also provide some resources. Again, they're great for meeting and also working with support people. They're all for all kinds of different traditional, non-traditional community supports, the faith-based community, whatever community you belong to, they're willing to reach out and work with them to support that person. And you can refer anybody. This is the only time you can make a referral on somebody's behalf. Obviously, I would suggest you have their permission or knowledge. Urgent access, if unfortunately your client is getting so distressed that you're afraid that that might amp up and turn into a situation where they might need an emergency intervention, obviously we want you to call 911. And again, I mentioned as you make that report and call, you can use your description. You want to really describe how the mental health is impacting the behavior. Really paint that picture for law enforcement. So, oh, so-and-so broke up with their boyfriend and they're screaming out in the street. No, so and so is under a lot of distress, is having a hard time emotionally regulating. They just hit a crisis. I really think that their mental health is impacted. That will more likely get that service triggered. Mental health urgent care clinic, love them. It's just what it says. It's a mental health urgent care clinic. It's for anybody who is a resident of Sacramento. You can walk in, it's unscheduled. They have peer supports. They have great places, quiet spaces where you can kind of hang out and chill out and talk with somebody with lived experience. You could be assessed. You could be assessed for services. If somebody is out of medications or is having trouble linking with their provider, that's a place you can go to too. It's also another focus on getting people linked. So if a person was experiencing homelessness and ended up at the mental health urgent care clinic, would do the best that they could to assess them, link them to our services. And if for some reason they didn't qualify for our services, they would find comparable services they could qualify for. And do we have housing? Yes, we do. We have 181 built units in 9 projects and many coming down the path. As you can see, it's a pretty big variety of types of buildings, neighborhoods, parts of town. We have everything from studio apartments at the Hotel Barry to, like cottages and small family stuff out in the courtyards and 7th and H and Boulevard Court. So it includes everything from singles to couples to families. Generally, people have to be chronically homeless and verified. I'll be honest, that's not a ton of units on our community, so there isn't a super high turnover, but there is a turnover. These are some of the units coming soon we're really excited about. And we have more services. I'm gonna have to jump off pretty shortly here, but what we offer is voucher supplements, rent gap, master lease, hotel motel, security deposits, utilities, building maintenance and repair, credit repair fees, housing document readiness, and moving expenses. So for all our folks who are at risk of homelessness or about to become homelessness, we can provide all of those services. So all of these providers got those additional dollars. And I'm afraid I am going to have to jump. This is just kind of bragging about our services. I've kind of told you all about how to get our services. I'm going to have to jump off the meeting, but I will be sending you all of these slides shortly, okay?
Hi, Nyajong, Hola, Ni Hao, Kombusta, Yao. My name is Jean and I'm with My Sister's House here in Sacramento, California. We have been around for 20 years now, serving Asian Pacific Islanders and any other population here who has been a victim of human trafficking, sexual assault, or domestic violence. We provide free services in the areas of legal, employment, shelter, housing, counseling, and we also have a 24/7 crisis line that is in operations every day of the year. Nyajong Gurumbe Sheng, Guahali Honyaho Sacramento, California, Taikata, who my sister's house. Bây giờ ít có theo hơi lười ấy có mua hồng đầu lòng gâu đầu co ấy có xả đi thế có xả khen đầu lỡ chỉ tao có thanh đầu chỉ tao có là cái khu bé mà đi phá xả tông giờ cho ý trâu lâu ó gì bé ó xa ý rồi có hai đua xả tông giờ cho ý trâu lâu ó gì bé ó xa ý khu bé mà đi phá này có chào. As previously mentioned, one of the core services that My Sister's House offers is a 24/7 multilingual crisis line. by calling 916-428-3271. Victims of domestic violence, sexual assault, and human trafficking can reach one of our crisis line operators every day of the year, even throughout the holiday time. My sister's house also offers the Women to Work program. With this program, we're able to help our clients build and develop skills necessary for employment, as well as create resumes that will best market our clients' experience as well as skills so that they can have the best opportunity in employment. What is very unique about my sister's house is that we have a social enterprise that will allow our clients to develop job skills as well as work experience in the culinary industry. We are incredibly proud of our clients who are able to participate in our social enterprise in order to gain the skills necessary for employment. In addition, my sister's house offers legal services too. We may also be able to assist with immigration issues. Our legal department has one family law attorney as well as a few other volunteer attorneys to support. While at my sister's house receiving services, they can also request for counseling services, whether it be individual or group. We currently provide a sexual assault support group as well as a domestic violence support group. We do this in order for our clients to know that they are not alone in their experiences. Currently, due to COVID, we are meeting via Zoom only. Currently, support groups are in English, and we also have one group geared towards Spanish speakers. Equally important, my sister's house also offers up shelter for those who need a safe place to stay. Whether it be 2 days or a couple of months, we are here to support you if you have been a victim of sexual assault, human trafficking, or domestic violence. Currently, we have 3 shelters and 18 beds. However, we are opening up our 4th shelter, which will be geared towards the Muslim population here in the greater Sacramento region. We also have a housing program that if clients would like to find affordable housing or need assistance in catching up on rent or utility bills, we may be able to assist with that as well. While we believe our services that we provide, such as housing, shelter, counseling, and employment services, are important, we also know that a community needs to be more educated on domestic violence, human trafficking, and sexual assault, as well as what my sister's house services are at organizations' requests, as well as offer various trainings throughout the year. One of our more popular trainings is our Cal OES required 40-hour domestic violence advocate trainings, in which students can come in and learn about the API population, as well as other topics related to serving victims of domestic violence, sexual assault, and human trafficking. Oftentimes, you will see us at outreach events or participating in online forums and discussion groups in order to get the word out about what we do and who we serve. My sister's house is incredibly honored to have the support of local community members and organizations who believe in the work that we do. we are able to participate in various local events such as the Women's March. The biggest mental health tip that we would love for you to take away from this is that you do have to practice self-care. Not just self-care physically, but you do have to try to practice it emotionally, physically, and mentally. For example, you can take care of yourself physically by leaving the relationship. But that's not all you need to do. You also have to make sure that you are taking care of yourself mentally and emotionally. What are you doing to go above and beyond and be able to be mentally well, emotionally safe? So keep that in mind. So, I hope that if you know anyone or if you find yourself in need of any support due to being a victim of domestic violence, sexual assault, or human trafficking, that you know that we are here to help. Feel free to call us at 916-428-3271 any time of the year. You can also check out www.my-sisters-house.org for more information. Thank you, and we look forward to hearing from you.
Hi, my name is Chase, and I'm the Prevention and Education Department Manager at Weave in Sacramento, California. I'm very excited to have the opportunity to share some information with you about Weave and the services and support we provide to Sacramento County. Weave's mission is to promote safe and healthy relationships and support survivors of sexual assault, domestic violence, and sex trafficking. Weave's vision is a community free of violence and abuse. Weave's 24-hour support and information line offers immediate intervention and support by trained peer counselors. Help is available in over 23 languages. You can call us whenever you feel the need to talk, regardless of whether the incident just occurred or occurred months or even years ago. We also offer a 24/7 online chat that you can access from weaveinc.org. Weave operates an emergency shelter program for survivors of domestic violence, sex trafficking, and their children. Our short-term program provides a short-term stay for survivors of domestic violence, regardless of gender identity. We also offer a long-term transitional housing program focused on removing barriers to housing, employment, and economic self-sufficiency. The transitional housing program is based on availability, and the length of stay is a minimum of 6 months. To support survivors in their healing, Weave provides free short-term individual and group counseling services to non-offending victims and survivors impacted by sexual assault or domestic violence, including friends or family who have been impacted by a loved one's experience. Weave also provides the community with advocates stationed throughout the Sacramento area. This includes advocates embedded within local schools and police stations, a sexual assault response team trained to support survivors through evidentiary exams 24/7, and a human trafficking emergency response and crisis intervention team. To access any of our Weave counseling, response, and advocacy services, you can call our support line or visit our website. Weave Legal provides legal assistance to victims of domestic violence, sexual assault, and sex trafficking. Services include free workshops about how to start your divorce in Sacramento County, completing financial disclosures, and seeking child support and child custody. We maintain a dedicated confidential legal line to assist you. If you need legal assistance or have any additional questions about our Weave legal services, you can contact our legal line at 916-319-4944. Our prevention and education team at Weave is committed to breaking the cycle of violence by educating the community to better understand the issues of domestic and sexual violence. Our department offers outreach presentations to local schools, teen groups, faith groups, businesses, neighborhood groups, law enforcement, healthcare professionals, and any other interested parties in Sacramento County. You can request a presentation or learn more about prevention and education at Weave on our website. Weave relies on the community to support victims of domestic violence, sexual assault, and human trafficking. You can donate your unused clothing items to any Weave store, and all proceeds from our stores help to pay for our free services. My mental health tip for the community is that it is okay to take a break. In fact, taking a break when you need it is a wonderful way to show yourself kindness. Take a break for a few deep breaths, a walk, or even a nap. Thank you, and be well.
Hello, my name is David J., and I'm the Executive Director of Sierra Harm Reduction Coalition here in El Dorado County, California. I segue my 15 years of experience as a vaccine researcher into becoming a harm reductionist. Our mission at Sierra Harm Reduction Coalition. We at the Sierra Harm Reduction Coalition provide a suite of community-based harm reduction services in El Dorado County to improve the quality of life of people who use drugs. We believe in the safety of our community. We respect the rights and autonomy of people who use drugs. We help each other help each other. So today I want to talk to you about how we provide rural harm reduction services in El Dorado County. I want to highlight the co-occurring crises of COVID-19 pandemic and the opioid overdose death rate increase in El Dorado County. I want to talk to you about how we provide low barrier access to our harm reduction services. And I want to talk to you about how we work hard to build trust and legitimacy among our rural people who use drugs and community stakeholders. So here on the top graph, we're looking at the opioid overdose death rate in El Dorado County from the beginning of January 2019 to the end of May 2020. And you'll see that about March 2020, where our shelter in place began in California, that we began seeing a very marked increase in opioid overdose deaths. If we break down those opioid overdose deaths overall into specifically those deaths that are attributable to fentanyl or synthetic opioids, we find that fentanyl is driving a lot of this increase that we're seeing in opioid overdose deaths in El Dorado County. So what Sierra Harm Reduction does to mitigate this is that we practice harm reduction. So harm reduction utilizes a spectrum of strategies to reduce the negative consequences that can be associated with drug use, sex work, and other behaviors. This can include safer using techniques, managed use, or abstinence and treatment. But our harm reduction is driven by a number of key principles. So we acknowledge that substance use is a part of our world, and our work is to minimize its effects. And to do this, we meet our participants with no judgment and with a lot of respect for who they are, where they come from, and we never coerce them to use our services or to go to treatment. That being said, we also, again, completely acknowledge that there are harmful effects that can be associated with illicit substance use. We also acknowledge that substance use is a very complex disease that can incorporate a whole continuum of behaviors and outcomes. So it's not exclusively abstinence or chaotic substance use. There's a whole spectrum in between there. And that's something that, we acknowledge that, some people, they do one shot of heroin in the morning and one at night. That is what they do every day, and they're stable doing that. I have a cup of coffee every morning. I feel sort of useless without it. And that's my substance use right now. Other people, it begins to get out of control, or for other people, what they are in treatment and what they need is complete abstinence. It's a whole spectrum of behaviors. But really, we are focused on the quality of life of that person. So we don't tell them not to use drugs. We provide the services that help them use drugs in the safest and healthiest way possible, so that if they are ready for treatment, we can navigate them to that. And we really do this by empowering, making sure that in our language and our behaviors that we empower the agency of people who use drugs to inform our harm reduction services and to inform how they want to incorporate harm reduction into their life and how they want treatment to look for them if and when they're ready for it. So how do we provide harm reduction services in a rural county like El Dorado County? We began by getting our syringe service provider authorization through the California Department of Public Health. So we applied to the Office of AIDS at the California Department of Public Health, And we were found to meet the requirements for authorization as dictated by California Health and Safety Code 121349. The California Department of Public Health Office of AIDS also determined that El Dorado County has conditions that exist for the rapid spread of blood-borne diseases, such as hepatitis C and HIV. So these are chronic diseases that can have a lot of prevalence, particularly among people who inject drugs. So we provide sterile syringes to our participants if they so desire them. We also provide safer using materials like tourniquets, alcohol prep pads, cookers, cottons, all the things you might need to safely do injections if that's your choice. We can also provide safer smoking materials like clean pipes, and we can also provide safer snorting materials such as cut in half straws and plastic razor blades. But these are not the things that define what we do. We also provide overdose prevention. So we provide Narcan and fentanyl test strips to our participants. Again, Narcan is the opioid overdose reversal drug. It's one little spray up the nose, and if somebody is experiencing an overdose, this brings them back, and they have a nice 90-minute window where they can hopefully engage with medical help to make sure that they don't slip back into an overdose again. Fentanyl test strips are really necessary because we're starting to find fentanyl in a lot of our substances. So fentanyl is not just something that you end up using on its own or something that is exclusively found in heroin. It's also being found in ecstasy and MDMA and cocaine and crack and particularly in methamphetamine. And people can use this very easy to use fentanyl test strip. We provide the water, the container, and the fentanyl test strip really works like a pregnancy test. So you use a tiny bit of your substance, dip this strip in there. 1 line, you have fentanyl. 2 lines, you have no fentanyl. And while this doesn't detect every single analog of fentanyl, it detects a whole lot of them and is definitely a safety precaution and goes a long way for overdose prevention. We also provide health and safety materials to our participants. So we provide wound care kits with surgical tape and gauze and petroleum jelly, things you might need to use for cuts that get infected or for sores that you get on your mouth or for abscesses that might be forming from bad injection. We also provide PPE kits because these are COVID times. We have face masks and hand sanitizer. And we also do syringe cleanup and disposal throughout our community. So we connect with local businesses and make sure that they know that if they find a used syringe that we will come and clean it up. But we also go and volunteer to do syringe cleanup at areas that might be kind of hot zones for used syringes to make sure that our community is clean and safe. We also provide our participants educational materials. I think it's a real misunderstanding that everyone who uses drugs knows how to use drugs appropriately. So I kind of highlight that in the picture of the body here, where these are safer injecting areas. So if you are going to inject drugs, here's where you want to go. When you start going out of these green checkmark areas, you have a number of harms that might come to you and something to be very mindful of. We also provide Narcan training. So we don't just provide Narcan, we train people. We train individuals one-on-one, we train small groups, large groups. We will do trainings in a parking lot, trainings on the side of a hill. It's really important that everybody knows how to use Narcan appropriately and knows what an overdose looks like and really how to respond to it and what your rights are in that situation. And we also provide material for how to safely dispose of syringes into OSHA compliant and FDA approved sharps containers, and what that looks like, how to not freak out if you find a used syringe when you're out in the community. And we also particularly inform our participants who inject drugs about the dangers associated with hepatitis C and HIV, what those symptoms can look like, what you can do for treatment, and we also navigate people to treatment. Something I don't have listed here, but something that we do a lot of is making sure that participants know what their rights are. So ensuring that participants know what syringe laws are in California, and making sure that participants know what paraphernalia laws are in California so they don't have unfortunate interactions with law enforcement. So it's really important for the work that we do to build legitimacy and trust. One way we go about that is making sure that we have a low barrier model for our harm reduction services. So to do our harm reduction services, we have a hotline number at 530-212-0279 that anyone could call. And we can talk to them about harm reduction and the services we provide, and we will make an order for delivery. And we will deliver to anybody wherever they are. We will literally meet people where they're at to make sure that they get our harm reduction services. We're hoping to find different ways to keep lowering these barriers, but this has been pretty effective. However, what I thought was going to happen when I first started this job was that our phone was going to be ringing off the hook. And how could we ever meet the need of everybody in this county for harm reduction services? And what was happening was people were not calling. And I had this interaction with a participant back in October, and they told me like, oh, I've had your number for like 2 months, but I didn't call because I didn't want to get arrested. Like, that's a problem. Oh, you don't trust us. You don't know who we are. You don't know that we're a legitimate organization, and that's on us. We have to make sure that our community of people who use drugs knows that they can trust us and that we are legitimate. And to do this, we do outreach. We go out into the community and we talk to people one-on-one about harm reduction and the services that we provide and how we can meet their need. And we literally find our rural community of people who use drugs and have a deeply empathetic conversation with them and let them know that we care about them. We also have to do outreach to our community stakeholders, so law enforcement, public health, local businesses, hospitals, medication-assisted treatment clinics, because this helps us build trust with them and build our legitimacy in the community. And we also reach out on social media. We have a robust presence on Facebook. But it's these partnerships that we have begun forming that are both informal and formal with our community stakeholders that have been really valuable. For example, we're a member of the El Dorado County Opioid Coalition, where we sit on monthly meetings and bi-weekly meetings in a harm reduction subcommittee group with a number of our stakeholders, where we talk about harm reduction, and we talk about what we do and let people know what our presence is in the community. And this has facilitated all these amazing partnerships that have just now been starting to bear some fruit. And that's been really amazing. And from my perspective, this is helping us build what I would call a recovery ready community. So whenever somebody is ready for treatment, we have all these different areas where people can come in with a harm reduction approach and get treatment and be treated in the best way possible, which may not have been their experience in the past. I want to share a story with you about how I became very aware that our rural harm reduction services work. And this was a few months ago. I got a call to go do some syringe cleanup. It's a pin dropped on a Google map somewhere in the middle of nowhere. And you don't really know it's going to be there. And I showed up, and there were maybe about a dozen campsites. Nobody was around. And you want to respect people's spaces, and I kind of trod through their space. But as I was walking around cleaning up used syringes that were outside of these different campsites, I found 2 discarded doses of Narcan from Sierra Harm Reduction Coalition. And it really impacted me deeply. One part of me was very sad that it was becoming cold and wet, and somebody experienced something as dramatic as an overdose in that situation. But Narcan that we provided was used to save that person's life. And that person gets to live another day, gets to have more opportunities to engage with treatment and to really change aspects of their life if they so choose to, and really become maybe a more productive member as they might see it within our community, and rebuild relationships with friends and family. And that's amazing. Everybody deserves a chance. If I had one piece of mental health advice that I would share with you, it's about empathy. And I would challenge all of you to be the empathetic conversation that someone has in the day. It goes so much farther than you would believe. So much of our work is letting people know that we care. So I would challenge you to have an empathetic conversation with someone who's having a hard time. Meet them without judgment. Listen to them with respect. And empathetically reflect what you hear. Validate their feelings. It might not be what you feel, but that's what they feel. And if you can empathetically reflect what you're hearing from that person feels heard, they feel cared about, and they'll listen to what you have to say. You know, I tend to listen to my friends, not to people who think they have their best intentions for what I might want. And so I would tell you to like truly exhibit empathy, give an empathetic conversation, and please meet people where they're at. And again, thank you for this opportunity to speak to you all. I hope you all have a fantastic day.